I'm going to talk about some of the treatment techniques we can use for different patients and different populations. So the first is neuromotor or augmented. So I've made some videos on facilitation and inhibition of muscles. So this could be good for in patients that have abnormal tone. So if they have hypertone of the flexor, so they're in a flex position, you can help to inhibit the flexor muscle, so the biceps, to get them back into an extended position based on whichever body part you're working with. This uses manual cues, so you're able to touch or tap or stroke to get the patient to either relax or contract the muscle that you're working with. The next is activity-based. So this one, you'll have the patient do activities that they would do in their daily life, and you'd have them do it in different environments, or you could have them modify it if you need to. So if you need to make changes to the way they might do it for their safety or just so they can complete the task. You can also work it in part or in whole. So if you need to work the first half of the task and then work on the second half later, or you can do it all together based on the patient. For this, you're going to be giving the patient feedback on their completion of the task. You can do it while they're doing the task, or you can give them feedback after. And then you'll also look at the use of assistive devices here or adaptive devices that they might use to complete the activity. The next is motor learning training. So for this, you're just going to be giving the patient feedback on whatever task they're doing or movement they're trying to learn. Again, you can change the environment for this. So if you're learning a task in a closed environment where it's easier for the patient to focus, but then as they progress, you move them into a busier environment where they have to rely more on the fact that this is now something they've learned and their muscles know how to do, so that it comes more naturally when they're in an environment that is not as conducive to them really cognitively thinking about the motor task. Another thing we can look at is compensatory techniques. So for this, you can have substitution, which would be the patient just does the task a little differently. So for example, if you're trying to go sideline to sitting on the edge of a bed, the patient can use their strong leg to hook their good leg to bring it over to successfully sit back up. So that would be a way that they could substitute the movement there and help complete the task. Another thing you can use is adaptation. So you could give them some kind of device to help. So this might be if they're going sideline to sitting, they could use the bed rail or the trapezoid bar to help pull them up, or anything like that that would be a device is helping them to modify the area. And then you can also use an assistive or supportive device. So this could be like your walker or your cane or anything that helps you complete the task that is an outside device. And then the last is impairment-based. So this, you're looking at techniques for certain impairments you see in the patient. So the patient, for example, is not able to complete a sit-to-stand, and their impairment you note is quad strength. You can work on strengthening with quad sets to help with the task of a sit-to-stand. Other things you might notice would be like if the patient has poor mobility, you could work on stretching or even joint mobs, depending on where you think the mobility limitations are, so to help facilitate improved mobility to complete the task.